Diarrhea is a common condition that involves loose stools that occur more frequently than usual. It can be caused by a variety of factors, including infection. Diarrhea is often caused by a viral, bacterial, or parasitic infection. Common pathogens include norovirus, rotavirus, salmonella, E. coli, and Giardia. Food poisoning. Consuming contaminated food or water can lead to bacterial infection, which can cause diarrhea. This is commonly known as food poisoning. Gastroenteritis. Inflammation of the stomach and intestines due to infection or irritation can cause diarrhea. Viral gastroenteritis is a common cause. Malabsorption. Conditions such as celiac disease, lactose intolerance, and inflammatory bowel disease can interfere with nutrient absorption, leading to chronic diarrhea. Medications. Certain medications, especially antibiotics, can upset the balance of bacteria in your gut and cause diarrhea as a side effect. Food allergies. Allergies to certain foods, such as nuts, shellfish, or dairy, can cause diarrhea in sensitive individuals. Irritable bowel syndrome, IBS. IBS is a chronic condition characterized by abdominal pain, bloating, and changes in bowel habits, including diarrhea. Stress and anxiety. Emotional stress or anxiety can affect the digestive system and cause diarrhea in some individuals. Traveler's diarrhea. Traveling to areas with different hygiene standards can expose individuals to unfamiliar bacteria and parasites, which can cause diarrhea. Inflammatory bowel disease, IBD. Chronic conditions such as Crohn's disease and ulcerative colitis can cause persistent diarrhea due to inflammation of the digestive tract. Appendicitis. Inflammation of the appendix can cause diarrhea along with other symptoms such as abdominal pain and fever. Excessive caffeine or alcohol. Both caffeine and alcohol irritate the digestive system and can cause diarrhea, especially when consumed in large amounts. Radiation therapy. Cancer patients receiving radiation therapy to the abdomen or pelvis may experience diarrhea as a side effect. Hypothyroidism. An overactive thyroid gland can cause a variety of digestive problems, including diarrhea. Most asked questions about diarrhea causes. What are the common causes of diarrhea? Diarrhea can be caused by a variety of factors, including infections, viruses, bacteria, or parasites, food poisoning, gastrointestinal disorders, food allergies, medications, stress, and certain chronic diseases. Identifying the underlying cause is essential for appropriate treatment. How does food poisoning cause diarrhea? Food poisoning occurs when you consume contaminated food or water. Bacteria such as salmonella and E. coli produce toxins in the intestines, causing inflammation and irritation. This irritation causes diarrhea, often accompanied by abdominal cramps and nausea. Can stress or anxiety cause diarrhea? Yes. Stress and anxiety can cause changes in your digestive system, which can lead to diarrhea. The gut-brain connection affects bowel movements, and high levels of stress can increase motility and cause loose stools. Is diarrhea always caused by an infection or gastrointestinal disorder? Infections and gastrointestinal disorders are common causes, but diarrhea can also be caused by factors such as food allergies, certain medications, such as antibiotics, excessive caffeine or alcohol consumption, and emotional stress. How long does diarrhea usually last? The duration of diarrhea depends on the underlying cause. Acute diarrhea, often caused by infection or food poisoning, usually resolves within a few days. Chronic diarrhea that lasts longer than a few weeks may indicate an underlying health condition and requires medical evaluation. When should I seek medical attention if I have diarrhea? It is important to see a doctor if diarrhea persists, is severe, or is accompanied by symptoms such as dehydration, excessive thirst, dry mouth, dark urine, bloody stools, fever, or significant weight loss. These signs may indicate a more serious underlying condition. What should I do to prevent diarrhea caused by food poisoning? You can reduce your risk of foodborne illness by practicing good food hygiene, including cooking meat thoroughly, practicing proper hand washing, and avoiding undercooked foods. Proper storage and handling of food is also important to prevent bacterial contamination. Can certain medications cause diarrhea as a side effect? Yes, some medications, especially antibiotics and certain antacids, can upset the balance of bacteria in your gut and cause diarrhea. If diarrhea persists while taking the medication, it is recommended that you consult your healthcare provider. Is diarrhea contagious? Diarrhea caused by a viral or bacterial infection can be contagious. Proper hand washing, especially after using the bathroom, can help prevent the spread of infectious agents that cause diarrhea. What dietary changes can help manage diarrhea? It is important to stay hydrated during diarrhea through drinking water, clear broths, or oral rehydration solutions. Avoiding caffeine, alcohol, spicy foods, and fatty foods may also help relieve symptoms. If diarrhea persists, it is recommended that you consult a healthcare professional for dietary recommendations.